Welcome back, everybody. Dr. Peter Glidden here, and it's Medical Madness Monday, where we pull back the veil, take a breath, take a look, and see what is going on in this crazy world that we're calling modern American medicine. Now, if I was colorblind and didn't know it, I wouldn't know it. And therefore, everything that I saw would be colored through one particular lens, and I wouldn't know that I wasn't seeing the full spectrum. I wouldn't know what I was seeing was not a full representation of the truth. Well, so it is with modern American medicine. MDs do not practice medicine. MDs are not trained in medicine. MDs are trained in reductionistic, allopathic, pharmaceutical centrist medicine, which is one aspect of the greater pie of medicine. It's one small section of the pie of medicine, but they have convinced us it's the only thing. It's all of the pie. Don't look anywhere else at what we have to say. Our little particular color-blinded, anachronistic piece of the puzzle is the only thing worth paying attention to, and it's not. And because MDs are colorblind, because their philosophy is colorblind, because their training is colorblind, because their application of medicine is colorblind, because their determination of diagnostic criteria is colorblind, because every single solitary thing that they do is colorblind, every single solitary thing that they do is jaded, inaccurate, and incomplete. This is why they're only good at surgery and trauma, because, you know, surgery and trauma are really perfect applications of a reductionistic method. A reductionistic method argues that when the body's broken, you take it apart and deliver one medicine for each piece. Well, when you have a bullet in your arm, that's the epitome of reductionism. When you have a third-degree burn on your skin, that's the epitome of reductionism. When you have a streptococcus bacteria in your lung, that's the epitome of reductionism, right? Get your leg blown off in Iraq, heaven forbid. That's the epitome of reductionism. Those guys can help that. But they can't help anything else. And because they're colorblind, and because they monopolize the medical theater, and because their hubris is legendary, and their arrogance is awe-inspiring, breathtaking, and stunning, they never, ever admit that their approach is incorrect, and they move the goalposts all the time, and they're unabashed and unashamed about it. You know, the New York Times today, or I think it was this weekend, big article comes out, salt may not be as bad as we thought it was. Oh, salt's all of a sudden not so bad, where they've been telling you for 50 years that it is bad, and we've been telling you for 40 years it's not. All of a sudden it's big news. They're also saying, oh, margarine isn't as good for you as we thought it was, and maybe we should go back to butter. Well, we've been saying that for 40 years. They move the goalposts all the time. Well, Premarin is good for you. Oh, no, the World Health Organization, the Women's Health Initiative was stopped 3 years short because the women that were undergoing the Women's Health Initiative were dying from the hormone replacement therapy, including Premarin. Oh, no. Yeah, Premarin's good. Hormone replacement is good. Oh, no. Hormone replacement is bad. Oh, salt is good. Salt is great. Oh, no. Salt is bad. Oh, no. Salt is good again, right? They move the goalposts all of the time, and culturally, we give them a pass. Every time they screw up, every time they hurt us, every time they drop the ball, we give them a pass, and we think to ourselves, oh, that's just science. That's just the way that it goes. Well, no, it's not. That's not science. That's not the way that it goes. You know, do you think that NASA, if somebody designed a rocket and it blew up 10 times out of 10 times when it lifted off, do you think they'd continue to go with that rocket designer? Do you think they'd continue to go with that rocket scientist? No. They'd fire him. They'd fire his butt and they'd send him back wherever he came from, because when you fail consistently in the scientific theater, there's something wrong with your perspective. But we don't do that with MDs because they monopolize the game. They monopolize the theater. They own everything. And, you know, like the kingdoms, you know, I'm really into this HBO program, Game of Thrones. I don't know if you've watched it, but it's, you know, it's all this stuff about a fantasy land where there's different kings and different kingdoms and they're fighting each other, and it's a real, sword and sandal kind of an action show, right? And when you're the king, hey, it's good to be king. King can do whatever he wants. And when the king screws up, which invariably kings are wont to do, they get a pass because they have all the power, they have all the money, and the little peasant peon, you and me, can go screw ourselves, right? This is how it goes in the land of modern American medicine. While MDs have been driving the bus of medicine, MD-directed treatments are the leading cause of death in the United States, eclipsing heart disease and cancer. 788,000 people a year are killed by MD treatments. 788,000 people a year are killed because they went to an MD. 550,000 people a year die from cancer, which means your MD is more dangerous than cancer, and yet we keep going to them. First they tell us one thing, then they tell us another, and we keep going to them. First they tell us to go south, and then they tell us to go north, and we keep going to them. First they tell us this drug is good, then they tell us this drug is bad, and then there are 61 class action lawsuits against drugs and surgical devices that have killed people, and we keep going to them. While they've been in charge of health care in the United States, our health is getting worse and worse and worse and worse. According to the CIA, we're slipping in rank in our health in the world. I think we're 41st or something like that. It's ridiculous. And we put up with it because we don't know any difference, and because he's the king. Who's going to argue with the king? Nobody's going to argue with the king, because what happens when you argue with the king? You get your head chopped off. For goodness sake, if you're a parent now and your child gets cancer and you refuse conventional cancer treatment, your child is taken away from you and you're thrown in jail. Is that correct? No, that's not correct. That's an overarching monopoly. And it is like this in every aspect. Doctors don't even ask anymore. I was working in Cape Cod, Massachusetts for almost 12 years. I'm originally from Nantucket Island, born and raised. I'm a tried and true New Englander. I had a private practice, a robust private practice in Hyannis, of Kennedy fame, right? I was literally 2 blocks away from Cape Cod Hospital. And my office was right in the thick of all of these. It was like the medical center of that part of Massachusetts. I had endocrinologists beside me. I had eye, ear, and nose and throat doctors in front of me. I had pediatricians beside me. And I was this little, naturopathic medical practice, right? Doing health consultations in a state that wasn't licensed or regulated for naturopathic medicine, but I had my sign up there, baby. Couldn't call myself a physician even though I'd had 8 years of medical education. Couldn't call myself a physician even though in 16 other states in the United States I could do that. Couldn't work in hospitals even though in 16 other states I could do that. Insurance wouldn't cover what I did in Massachusetts because they're backwards and completely controlled by the medical monopoly, the medical mafia. MD doesn't stand for medical doctor, right? It stands for medical deity. What they say goes. Everybody else can walk. Now, is it right that one particular type of medicine is able to monopolize the medical theater in one state, and you cross the state lines and it's a completely different thing? Well, what happened to science? According to the politicians in the great state of Washington, as a naturopathic physician in Washington, I can deliver babies, perform minor surgery, order prescribe drugs, work in hospitals, call myself a physician, order any diagnostic tests I want, and it's all covered by insurance. But if I was to cross the state lines into Illinois, where I currently live, and practice medicine in the state of Illinois, I'd be thrown in jail and fined $5,000 for practicing medicine without a license, just because I crossed the state line, and that's not right. And yet we put up with it. Why aren't we marching on the State Hall? Why aren't we, out en masse in Washington, D.C., saying license and regulate the naturopathic physicians, or more to the point, hold the MD's feet to the fire? Why don't we do that? Because we don't know any better. They move the goalposts on us all the time, and we give them a pass. They kill us, and we give them a pass. They kill our parents, we give them a pass. Our children are born with horrible birth defects, autism, we give them a pass. Ladies and gentlemen, it's time to stop. It is time to snap out of it. It is time to lift yourself up, pick your head out of the dirt, dust yourself off, look around, call a spade a spade. Fire your MD now. They do not deserve your business. They do not deserve your patronage. They do not deserve your respect. They do not deserve even a second thought. You know, if you're bleeding to death, go to the emergency room. That's what they're good for. But remember, according to Harvard University, 51% of the physicians working in the emergency room are addicted to street drugs, alcohol, or prescription medicine, which means you should demand, if you're if heaven forbid you're transported to the ER, you should demand that your doctor be drug tested before you let him near you with a scalpel. But are you going to do that? No. Oh, no, I can't do that. My doctor's a nice person. Well, your doctor might be a nice person, but your doctor is also a reductionist. Your doctor is a colorblind reductionist who's completely wedded to the pharmaceutical industry, may or may not know it. All they know is drugs and surgery. With them, it's drugs and surgery all the time, even though drugs and surgery all the time fail us most of the time. We have to stop giving them our money. So what are we going to do instead? You're going to tune into this radio station. You're going to go to fireyourmdnow.com. You're going to go to drglidden.com. You're going to sign up for the webinars. You're going to buy the books. You're going to get some audio CDs. You're going to get some DVDs. You're going to ask questions, educate yourself, lift yourself up into the wonderful world of health, because healing is easy. If you're suffering with chronic disease, a heartburn, fibromyalgia, rheumatoid arthritis, osteoporosis, osteoarthritis, high blood pressure, eczema, psoriasis, if you have a difficulty getting pregnant or carrying a pregnancy to term, you have the wrong doctor, period. It's not your fault, your doctor's fault. Fire your MD now. Give me a call here. I'll talk you through whatever you need to know. Our number here, toll-free at the station, to talk to me live today, 866-582-9933. That's 866-582-9933. Remember, that's toll-free, 866-582-9933. And life is good. Ladies and gentlemen, stick to your guns, pick your head up out of the sand, fire your MD, take your vitamins, change your diet, and let's get healthy together. By the way, folks, if you wish to be supported by myself and my team in your supplement purchase and journey to health, then call this number. We're here to hold your hand and guide you. That's 855-347-3696. That's 855-347-3696. Once more, toll-free, 855-347-3696. Now we're going to go right to the phones today. I believe we have Kevin listening in with a question about eczema. Kevin, you're live with Dr. Glidden. Welcome aboard.
Thank you, Dr. Glidden. Love listening to you. I've got my sister. She's 5'1", 170. She's got that seasonal eczema, no asthma, no bronchitis. She's got shin splints, and then she's also weighty, so we need to get her on that ASAP, but I guess that's a second-month thing.
Okay, yeah. So here's the deal with that. Let's talk about that first. Okay?
And I also have something about my mother, too, but I don't want to take up too much time. So.
All right. Well, we'll talk about these couple things first. So the weight gain, you know, when somebody is overweight, they've got too much fat in their body. The reason that they have too much fat in their body is because they're undernutrified and their body is starving for nutrients. So the body, your central nervous system, makes you eat. It's not psychological, it's not genetic, it's not behavioral, it's not a lack of exercise, it's a simple nutrient deficiency disease. And your central nervous system knows that it's running on fumes because it has wisdom that MDs completely, overlook and deny, quite frankly. So your body is pushing you to eat in the desperate attempt to fill up its nutritional tank. The only problem is the stuff you're eating doesn't have the nutrients in it. The food that you're eating doesn't have it. So you eat 3,000 calories at Olive Garden, and 2 hours later, guess what? You're hungry again. It's crazy, right? So now we've got all this fat on the body. And what are we going to do? Well, we're going to start to nutrify the body with the 90 essential nutrients, 90 for life. So we clean up our diet, stop eating the bad foods. We take the nutritional supplements into the body, feed the body nutritionally, and when the body's vitamin and mineral and amino acid and essential fatty acid tank is filled up from high-quality, easy-to-absorb nutritional supplements, your cravings disappear. So then what happens? Well, your body starts to burn fat. Because that's what it does. It'll burn fat. The only problem is most of the nasty crap that we, and that's a medical term, by the way, that we experience in the environment, like carbon monoxide and secondhand smoke and petrochemicals and, pesticides on our food and all this stuff, all of these exogenous nasty chemicals that we're exposed to just in our walkabout life are stored by the body most often in fat. The body will stick that crap in fat to get it out of the way, because most nasty crap is fat soluble. So your body sequesters it away in fatty tissue to get it out of the normal circulation. Now, when you start to burn fat, guess what happens? You liberate all those chemicals. And then they're nasty. The body stuck them away someplace for a reason. And also, by the way, in order to detoxify those nasty chemicals, your body needs nutrients. And so if you don't have enough nutrients in your body, and you go, on a dedicated fast or some aggressive method to burn fat and lose weight, it's like stirring up a hornet's nest. Because you will burn fat, you're going to liberate all these chemicals, they're going to enter your circulation again, go into your liver. Your liver is going to try to deconstruct them, but it won't have the nutrients that it needs to. So the nasty crap passes right through your liver, unobstructed. It's like the enemy coming through the front walls of the gates of the castle. It's all over for you, baby. So aggressive weight loss without proper nutritional supplementation to promote healthy detoxification is a fool's errand. And this is why I don't like to see anybody on the ASAP program for 2 or 3 months. Because one thing that the ASAP program does is you'll burn a pound a day, man. You go on that program, you do it correctly, you'll burn a pound a day. And in order to handle the stress of that, your body needs to be nutrified. So that's the kind of foundation idea behind the Dr. Glidden's method of first we nutrify, and then we detoxify, and then we rapidly lose weight. So, when people go on the good food, bad food diet and start to take the 90 essential nutrients appropriate for the body weight, they'll lose about a pound a week, sometimes 2 pounds a week, and that's slow and steady, baby. But more importantly, you're going to be filling up your body's nutritional tank. That takes 2 or 3 months, and then after you've been doing the program for 2 or 3 months in a slow and steady fashion, if you want to accelerate it and move it forward, then you go on the ASAP program while you're maintaining the 90 essential nutrients. Now, shin splints is a simple calcium and magnesium deficiency, and eczema most of the time is an allergy and an intolerance to wheat. So all that your sister needs to do here is go on the gluten-free diet and do 1 anti-aging healthy start pack per 100 pounds of body weight per month, plus a bottle of plant-derived minerals, plus an extra bottle of Cal Toddy. Everything should get better in 4 weeks, and that's a mouthful. Welcome back, ladies and gentlemen. I'm Dr. Peter Glidden, your friendly neighborhood naturopathic physician, and we're talking to Kevin, who also has another question. Is that right, Kevin?
Yes, sir. My mother is 145 pounds, 5'3". She's got that Hashimoto's thyroiditis, and she said it's at that middle state of globular. It's like not liquid, not hardened, so it's sort of both. She said all her numbers were good, except that she's worried about that antigen level. She wants to know how to lower it. I told her ORAC value, but I didn't know if that was the right way to say it or anything like that. And she also suffers from candida, and she loves mushrooms, very scared that she won't get to eat them. And you have that Java Fit coffee, which I wanted to get her. And I guess forskolin is a plant that she was interested in trying, and I wanted to get your input on forskolin. It might be referred to by another name, more common name, starting with the letter C. I don't know how to pronounce it, but forskolin.
Yeah, Coleus forskolin. Yeah, I'm familiar with it. Yeah, so we don't need to worry about that. What we do need to worry about when it comes to the thyroid is the neck. And most of the patients that I've seen that have any type of a thyroid condition, regardless of the diagnosis, right, whether it's underactive, whether it's overactive, whether it's Hashimoto's, Graves' disease, or whatever the heck it is, simple goiter, most of these patients have a problem with their neck, and that the curve in their neck is not correct. There needs to be a gentle S-curve in the whole spine from the base of the skull to the tailbone. If you look at somebody's profile, someone who's healthy, the spine has a nice little S-curve to it, and it starts in the neck. And if the neck the curve is reversed. I've seen the curve be reversed. I've seen people's neck be completely straight, no curve at all. That's going to compromise the nerve signals that are coming out of the cervical discs that feed the thyroid. So one thing we need not overlook when we're helping somebody to support and promote the health of their thyroid gland is their cervical spine. So I would find a good chiropractor, have them do a digital x-ray of the neck from a side location and check to see whether the neck is put on the body straight. And if it's not, then your mom's going to have to get on board with some type of chiropractic adjustment on a regular basis to reassert the curve in her neck. And when that happens, life is going to be much better for the thyroid gland because the nerve signals that are going to be coming out of the neck are going to be 100%. And, you know, that's better than 50% or less, okay? So that's number one. Number two, the three things that the thyroid gland needs to be healthy are iodine, selenium, and copper. Iodine, selenium, and copper. So we want to emphasize the use of iodized table salt with anybody that has a thyroid problem, number one. And selenium and copper are found in a perfect balance in Dr. Wallach's longevity supplement called Ultimate Selenium. So, you know, it's with someone with a pre-existing thyroid condition, in order to support and promote the health of the thyroid, we would need to do more than we would for maintenance of the thyroid gland. So in this regard, to accomplish that end, I would recommend 12 Ultimate Selenium a day, 4 with breakfast, 4 with lunch, and 4 with dinner. And by the way, it is possible to take too much of Ultimate Selenium. It's hard. It's possible, though. I've only known one person in 4 years of doing this that this has happened to. If you take too much of the Ultimate Selenium, your breath gets a fishy, garlicky odor, your hair starts to get a little dry, and your fingernails will split. If those symptoms start to happen, you just back off on the dosage, you know, by 20%, okay? But that's just a cautionary tale at best, all right? Now, the last thing that we can do in our armamentarium here to support and promote the health of the thyroid is Ocean's Gold. The Ocean's Gold is a sea kelp formula that's loaded with copper and selenium and iodine and a bunch of other things as well that feed the thyroid gland appropriately. So with Hashimoto's thyroiditis, with a pre-existing thyroid condition, I would go for break with the Ocean's Gold. I'd take 6 or 9 a day, depending on what the budget can afford. Now, with any type of itis anywhere in the body, whether it's arthritis or thyroiditis or pancreatitis or whatever it is, we, of course, want to increase ORAC, because ORAC-itis means inflammation, and ORAC is anti-inflammatory. So we want to increase our consumption of anything that has anti-inflammatory activity. However you want to do that, whatever in the budget. Triple Treat chocolate is the best way to do it. Failing that, you can do the Cell Shield RTQ, and failing that, you can just lean on the Beyond Tangy Tangerine. There's about 6,000 ORAC there per 2 scoops. So really, that's what I would do with your mom. And Candida, if it is present, which is doubtful. And by the way, I'm one of the doctors listed in the back of the Candida Connection book because I have a lot of experience with Candida. 99.9% of the time, the problem with Candida is not the Candida. The problem with Candida is there's too much sugar in the blood. So anybody that really does have a definitive diagnosis of a Candida infection, which, by the way, is not easy to do, we want to support and promote the health of their blood sugar. So I would add sweeties to the diet at a 9 a day, and it's 9 or 12 a day. It's best to take that before a meal, about 20 to 30 minutes before a meal. It'll work if you don't do that, but it's best to do it before a meal. And also, as an experiment, I would go 100% extracurricular sugar-free for 90 days. That means no fruit, no fruit juice, no dried fruit, no honey, no agave, no maple syrup, no nothing that's got sugar in it whatsoever for a couple of months while you're doing the sweeties, and that should round things out nicely. Okay, Kevin, give that a try. Give that a roll. Call us back with a report. I'll look forward to it. We got to go to the phones now with Butch. I think Butch calling in with a question about osteoporosis. Butch, you're live with Dr. Glidden.
Thank you, Dr. Glidden. I actually have 2 things. I'm trying to get my order together before my auto ship goes out. One is myself. I'm 50 years old, 5'11", 185 pounds. I have osteoporosis by by listening to the shows from what Dr. Wallach and you have described. Degenerative disc disease, joint disease, kidney stones. I had Bell's palsy years ago. Also, what's going on is when I was in basic training, I had thought I was having a heart attack. And since then, I will get a chest pain, and it will radiate to my left or to my right arm, and I can feel it in my neck and my jaw and in my right arm. And then I get like a feeling of deja vu, like I've been somewhere before, and it's always the same one. Is this delusion?
No. When does that happen, Butch?
Well, it happens now, like every, 2 or 3 months.
Under what circumstances?
Usually just...
Out of the blue? No reason?
Right.
Okay. Do you live in a town where there's a decent chiropractor?
I don't know. I live out in the woods.
You live out in the woods. What's the closest town? What's the closest town to you?
Probably Springfield, Missouri.
Okay. So the next time you're in Springfield, Missouri, I would make some calls, or, just get the yellow pages for Springfield and call a couple of chiropractors' offices up. Springfield, Missouri, the Midwest is a great place for chiropractors because that's where it started. You want to find a chiropractor who has an ECG or an EKG machine in his office or her office, okay? And I do not want you to go to the emergency room. I do not want you to go to a normal medical doctor for this, but you should have an EKG done to just check what the heck's going on with your heart, because we don't want you to be having like a borderline heart condition, right? And that type of a thing is pretty easy to see with, a heart monitor. So I would find a chiropractor that checks that in their office, make an appointment, go see him, get your heart checked out just to be on the safe side, okay? That's, better safe than sorry. Do not go to an MD for this, all right? Zero tolerance for MDs. Find a chiropractor that can do this for you, and they will hook you up, number one. Number two, as you already know, Butch, and now you're the smartest man in class, osteoporosis, degenerative disc disease, kidney stones, and Bell's palsy are all arms of the same octopus. Those are all different manifestations of not enough calcium and not enough magnesium, period. End of story. So what you need to do is take a 200-pound dose of the nutrients with extra calcium. So here's a really good way to do that. You ready? We're going to write this down. If this is inside of your budgetary wheelhouse, the optimal program for you would be, per month, 2 bottles of Ultra Body Toddy with Cell Shield, 2 bottles of Cal Toddy, 2 bottles of Cal Toddy, 2 bottles of Glucogel at the 240 count, 2 bottles of Glucogel at the 240 count, 4 bottles of Ultimate Selenium, and 1 bottle of Ultimate EFA at the 180 count. All right, that's 1 EFA, 4 selenium, 2 Glucogel at the 240 count, 2 Cal Toddy, 2 Ultra Body Toddy with Cell Shield, and life is good. Now, the only reason that this is happening to you, Butch, is because, unwittingly, it's not your fault, it's your damn doctor's fault, you've been eating wheat, barley, rye, and oats your entire life, just like everybody else in this country. And when you eat those foods every day, they impair your body's ability to absorb nutrients from the food. Now, the food doesn't have enough nutrients in it anyway. I mean, the food is nutrient poor. But now when you eat, Wheaties for breakfast and whole wheat sandwiches and pizza and bagels and cookies and crackers and donuts and stuff like that, all the time like we do in this country, we are grain crazy here, baby. Every time your body metabolizes that stuff, it knocks down its ability to absorb nutrients. So, you are generating unwittingly again malabsorption, which generates malnutrition, which generates every single solitary thing that you've got going on here. Remember, Betty Crocker was not a doctor, right? So we're not going to listen to any of this nonsense from the food industry. We have to start doing things differently. So please, go to fireyourmdnow.com and download the Good Food, Bad Food document that's right there on the front page. It's free, and, if you want to bring yourself up to speed with how these things hurt you, there's a little video there. It's called Against the Grain. You can watch that. That's also a free document. So clean your diet up. Take those nutritional supplements. Get your heart checked out by a chiropractor who has an EKG machine in their office, just to be on the safe side. And, this program should be a good program for you, but you're going to increase remarkably, Butch, the efficiency of this program if you clean your diet up. If you keep eating wheat, barley, rye, and oats, if you keep eating that stuff, it's going to be 3 steps forward with the nutrition and 2.5 steps backward with the diet. Your body's going to make progress, but it's not going to be enough to keep you happy. It's not going to be enough to really make any difference at all. So this is like the 1-2 punch, baby, right? We got to get them on the ropes, rope-a-dope, boom, boom, float like a butterfly, right? Sting like a bee, clean up the diet, take the nutritional supplements. And when you're on the right nutritional program, you, me, the man in the moon, anybody, when we've got it dialed in just right, you feel better, your energy's better, your mood's better, your sleep's better, your weight's better, your sex drive's better, everything brightens up, and this is what drives us forward. So you want to be paying attention here to subjective results, how you feel, how your energy is, how your sleep is, stuff like this. And as long as all of that stuff is improving, then life is good, you're good to go, and we don't need to worry about doing any expensive, invasive laboratory tests that the MDs will be drooling and salivating, looking at you like you're a freaking ATM machine. Remember, Butch, the most important thing for you to do in this conversation is fire your MD. Do not go to those people. Find a good chiropractor and tell them about me, by the way. We're going to spread this word, spread the news about this radio station. Butch, if you're still listening, one thing else that I forgot, it might not be a bad idea to add some enzymes to your diet for 4, 6, or 8 weeks that will facilitate absorption of all these nutrients and kind of give your system a jump start, right? 2 enzymes before a meal. It's not a bad way to go on. It's not a bad add-on. All right, I think we have Bob calling in now. Bob, are you with us? You're live with Dr. Glidden.
Jeff, how are you doing, sir? Yeah, I would like for you to help me. I've gotten my blood and urine panel tests and also had an annual checkup, and the report came back. I'm kind of disturbed with some of the results. And also, before I go into that, I do have high blood pressure. I can't seem to get it to go down. But what the checkup revealed was that there's blood in the urine, a little bit of blood in the urine, protein in the urine also, and the HDL was 290 and the LDL was 195. And
you sure you don't have those reversed? HDL is 290?
Yeah, that's what they said. Both of them were too high. It says here LDL cholesterol 195 and total cholesterol 290.
Okay, what about HDL?
HDL is, let's see, 79, and triglycerides is 78.
Okay. So that's perfect for cholesterol. You don't need to worry about that. They're wrong. They've always been wrong about cholesterol. They were wrong yesterday. They were wrong 2 days ago. They were wrong 2 years ago. They were wrong 10 years ago. They were wrong 20 years ago. They've always been wrong about it. They were wrong about bloodletting. They were wrong about Premarin. They were wrong about Norvasc. They were wrong about Celebrex. They're wrong about everything all the time. There's no relationship at all between cholesterol and heart disease. It does not exist. Just as many people get heart attacks who have low cholesterol as high cholesterol, and if there was anything at all to do with cholesterol and heart disease, then in the last 30 years, while we've been taking statin drugs to the tune of $25 billion a year, plus low-fat diets, plus exercise, something should have happened to heart disease statistics, but they haven't. We've got just as much heart disease now as we ever did, even though we're taking statin-lowering cholesterol drugs up the wazoo. You do not need to worry about it. As a matter of fact, 290 is pretty good, because all of your brain, well, not all, but the vast majority of your brain and your central nervous system is made from cholesterol. So you need to have high cholesterol levels for health, for overall health. Okay, now LDL is an indication of oxidative damage happening in the body. So when your LDL is high, that means that there's inflammation going on in your body of an oxidative nature, and you need to increase your intake of antioxidants. All right? Now, blood in the urine, protein in the urine, the most common cause of that, of course, is a simple urinary tract infection. Did they recommend that you take an antibiotic for that?
Not yet. They said that they're going to keep an eye on it. Because,
they're going to keep an eye on it. Good for them. They're going to keep an eye on it. They're knuckleheads. You need to fire these people.
But the more disturbing thing was that the test revealed cysts on the kidneys.
Yeah, kidney cysts. There's nothing. The only people who benefit from a kidney cyst or who should be alarmed by a kidney cyst are the accountants at the hospital, in case you don't do anything about it. You've had those kidney cysts your entire life. You're going to have the kidney cysts until the day you die. There's no problem at all with cysts on the kidney. It's a normal function of the kidney. You know, it is an indication that there's something going on there, but there's nothing. You're not going to die from a kidney cyst. The only people that, it's like fear-mongering. Oh, you've got a kidney cyst. Oh, my goodness gracious. Well, guess what? You've always had the kidney cyst. There's not a problem at all with the kidney cyst. But you need to clean your diet up, buddy. You need to go to fireyourmdnow.com. Don't worry, it's free. Download the Good Food, Bad Food Diet. There are 10 bad foods you need to not even look at. So download that list. Stop eating those foods. And here's what I would do for 1 month. I would do 1 anti-aging healthy start pack per 100 pounds of body weight per month. 1 plant-derived minerals per 100 pounds of body weight per month. And 1 bottle of Killer Biotic per 100 pounds of body weight per month. Throw in some selenium as well, because it can't hurt. Take 3 or 4 bottles of selenium a month. Take those supplements. Clean your diet up. Watch the hypertension come down. Watch your weight come down. Watch your state of being increase. Watch your energy levels increase. And for goodness sakes, please fire your MD now.